Welcome to Healthbeat, the show that takes the pulse of South Africa's healthcare system. I'm Mia Malan. This may look like any other city street, but it has a unique addition, a place where people can anonymously leave babies. This facility is at the heart of a battle between the government and non-profit organizations that support babies in crisis. Some estimates say about 3,500 babies are abandoned every year in this country. That was in Nkgomotso Mgiba's mind when she fell pregnant 13 years ago.
Nkgomotso Mgiba had a baby when she was only 17. She received little emotional support from her family the first time round, so when she fell pregnant again at 23, she wanted things to be different.
When I told him I was pregnant, he was so excited. We were already planning for a future.
But then her partner changed his mind.
I eventually saw that he's not interested because he would tell me that I'm not ready to have another child. For him, apparently, it's the third child.
He gave her 3,000 rand for an abortion, but she resisted and delayed.
I remember the last sauna I took was a 3D sauna, and she was sucking her thumb. I saw her clearly. So deciding for this life, I had to make a decision.
By the time Nkgomotso was full term, she'd made up her mind. Adoption would give her baby a stable future. She found an agency online, but the stigma floored her.
Birth mothers are not protected. Even the cleaners know about your file. It's written adoption in capital letters in a black marker. Even when the nurses see your file, they will still want to convince you that there is a child social grant. You can still apply for this. You know, in our culture, it's not allowed. There was the nurse who helped me. She was a mother. Before being a nurse, she was a mother. She was helpful, respectful. She was worried about my emotional health.
I think the fact that she's willing to talk about it is a unique bravery. I think the experience that she's had is fairly universal.
Robin Wolfson Foster's NPO for the Voiceless works towards protecting children's rights.
There's a lot of shame and anxiety for many birth moms around the fact that they've placed their children for adoption. There is very little in the way of working specifically with birth mothers to help them to process what the emotions are, what the complexity is of making this decision. Yes, it might be in the best interest of the child, but that also comes with a unique amount of pain.
The agency looked after Nkgomotso well, and her daughter was adopted by a family in Europe. They still swap photos and letters.
At first, I wanted this to be a secret, and only me and my daughter would know about this. I shared it with my family. They reacted the way I expected. I went into depression state. I started having anxiety attacks, heart palpitations. People were laughing at me on the street. There were many names I was called by. I sold my child. I abandoned my child. To my surprise, I found out that there are whole other women out there who are going through the same thing, and they're just masking it with makeup.
Then you add into that mix the fact that in a South African context, adoption is not considered to be a child protection option that is favoured. We want officials who are really genuinely understanding of what that mum's situation is and enabling rather than gatekeepers.
While I was pregnant, I just bought a normal exercise book, turned it into my pregnancy journal to share my journey with her. You just need to write using your own handwriting. And you know, when we develop from being children to being adults, you notice that, oh, my handwriting looks like my mother's or my dad's. Those are the small things that she will look up to.
This is what could have made Nkgomotso's decision less dramatic. It's called a baby saver or a baby hatch. Basani Maluleke is the social worker who manages the centre. Basani, how does this box work?
The moment the mother comes from the outside and places the child, we'll hear the alarm from the house. And then we've got Charmaine who works here, meaning the baby saver will come out with a key. This box is always closed, it's always locked. And immediately the mother places the child from the outside. The box locks itself until Charmaine comes, so no one is gonna able to open the box from the outside. So she will just come here and unlock the box.
Now, once a mom places the baby here, do you sometimes get to meet them, or do they just disappear?
They disappear, but most of the time they stand by the corner just to ensure that the child is being taken or is being received from the inside. Some might come back and knock after we receive the child to say, "This is my baby, I would like to talk to someone."
And then what do you talk about?
We just make appointment with them and then start giving them counseling and other options that are there, and see if we can help them to reunify these kids with them, just to understand.
So what happens to the baby once you've taken it out of here?
Charmaine will notify the social workers, and then we'll start preparing to come and fetch the child to the 2 houses. We've got 2 houses in Glen Vista where the child will go and live there.
Baby boxes can be a lifeline, but the people behind them stress that they must be regulated and only used as a last resort when mothers have no support.
It's not taking away parental rights, it's saving lives. And I just wish the department would notice that and realize that.
In 2023, the Gauteng Department of Social Development ordered baby savers in the province to close down. Mothers who use the service, they say, are guilty of child abandonment. Instead, they should leave their unwanted babies at state institutions like hospitals and police stations.
So you have access to these facilities at any given time. So why do you decide to put yourself at risk, let alone the child, by dumping this child, by abandoning this child? We also have the baby savers out there where you have these boxes and you think you can just leave your baby there and disappear. Now, like I said to you, abandonment is a crime.
Nadine Grabham is the Operations Director at Door of Hope and co-founder of Baby Savers South Africa, a coalition to which more than 500 babies have been safely surrendered.
The idea of a baby saver box actually goes back to the 14th, 15th century when the Catholic churches had foundling wheels where mothers could place their babies. So Door of Hope in South Africa invented the modern day baby saver, which is the baby box built into the wall with a sensor pad, magnetic lock and an alarm system. And we did this in April 1999.
But the Gauteng government has now placed a moratorium on baby savers in the province. Why is that?
The Department of Social Development, Gauteng specifically, in October 2023 called all savers illegal and that they should close with immediate effect. Their reasons being that it makes it easy for a parent to relinquish their parental rights. I think the mere fact that a mom carries that baby for 9 months and still chooses to make the right decision to keep that baby safe surely cannot be an easy decision. We have had people come from Uppington to Johannesburg to safely relinquish that baby. Nobody can say that that is an easy decision to make.
Now, despite the moratorium, you're still operating your baby saver in Berea. How does that work?
Our saver has been open for 25 years. We have not just saved close to 300 babies through our saver, but we've taken in close to 2,000 babies through our door. In a short space of time where we got a court order to deem us legal, to carry on with the status quo and not to close our saver, we got 9 babies in like 8 weeks through our saver. The saver is needed. We will not close our saver. It's saving lives. It is not an aid to child trafficking. It's not taking away parental rights. It's saving lives. And I just wish the department would notice that and realize that.
But is what you're doing not illegal?
The baby saver is not illegal. Nowhere in any document in South Africa are there words that state a baby saver is illegal. DSD Gauteng specifically claims it's illegal because they see it as a mother or a parent or caregiver abandoning a child. Abandoning a child is illegal when a baby saver is used. Mom is not abandoning her baby. She wants a better life for that baby. For every child that we have got paperwork issued by the Department of Social Development. And I think that is maybe why the matter is going to be taken to court, so that there's actually clarity on what is the best interest of the child.
Door of Hope took the matter to court, asking for baby savers to be legally recognized as a safe way for mothers to give up their babies into the state's care. Lawyers Candice Pillay and Nicola Irving are leading the pro bono team. Nicola, why does the Department of Social Development want to get rid of these boxes?
So they regard, from what we understand, the baby boxes as aiding and abetting the crime of abandonment in South Africa. We would argue that it does not encourage abandonment because based on the research of our experts, of which we have quite a number in our papers, mothers who are desperate enough to want to give over their babies will do so whether there is a safe and accessible way of doing so or not.
By law, abandoning a child is a criminal offense. If they want to abandon a baby, legally, what are their options?
Well, currently, the Children's Act says that you can hand your baby over at a police station, but remember, you're committing a crime at the same time. Parents and caregivers are not taking up that option for the very real fear that once you hand over your baby, you will promptly then be arrested or reported to the authorities for giving up the baby. It must be said that our police services are not equipped to look after babies. And what would they do if a child was brought to them? And so a lot of them don't know the law, they don't know the Children's Act. There are actual examples of women who were advised by our clients to go to the Department for Social Development, and then they were told, you're a bad mother, what's wrong with you, you can't look after your child. They were told to take their child back and look after them.
What's the legal principle that you're using? Is it a constitutional right?
Well, first and foremost, it's the best interest of the child, and that's been recognized worldwide. It's in our constitution, it's been carried through into the Children's Act, that every decision you make, every consideration of the child must follow the test of the best interest of the child. So when we look at baby boxes, is it in the best interest of a child to be put in a bin bag and thrown at the side of the road or in a toilet, or is it in the child's best interest to be placed safely in a box where there's a recipient on the other side waiting for it and knows the steps to be taken to put that child into a system so that the child can have all the rights that it's entitled to?
The Department of Social Development says this isn't a problem. There aren't that many abandoned babies. Why would you fight so hard for this then?
From 2020 to present, there are hundreds of cases, and those are just the cases that have been reported on. One of the experts in our papers is a forensic pathologist who, in her one mortuary alone, has noted hundreds and hundreds of cases in the past 7 years of either concealment of birth or abandonment.
So the government says that baby boxes make it easier to traffic children, for instance. What's your response to that?
The DSD has not been able to show us where children are being trafficked, how many are being trafficked. Their concern is that because of the confidential nature of the baby box and the anonymity provided to the person handing over the baby, that anyone could steal other people's children and put in the baby box in the hopes that there'd be a fee. But the department has been asked to regulate the baby box. Our client has specifically engaged the department to say, we're just registering them, which is an organization representing their interests, but you can regulate every single baby box in the country. You can set criteria for the baby boxes. Why don't you do that?
Any indication of when the next court date is?
We've issued our papers. They've been served with the papers. We have a few that have indicated their intention to oppose, which is the Department for Social Development. We'll also have issued papers against the minister. So we will just wait on all the parties responding as to whether they're going to oppose this application. We have a new development now with it was an amendment by the Parliament Portfolio Committee calling for the definition of abandonment to include babies who are placed in baby boxes.
Baby boxes currently operate in a legal grey area in South Africa. And that's primarily the question that we're asking the court to answer, is where do baby boxes fall given the circumstances and the context of abandonment in South Africa? Where do baby saver boxes fall within the greater scheme of child protection laws?
Nicola and Candice, thanks very much for your time today.
Thank you.
After the break, how can pregnant mothers be better supported so that they don't have to give up their babies? Welcome back to Healthbeat. Pregnancy and childbirth come with many extra challenges, especially for women with little or no money. We spoke to a mother who found herself in a predicament.
What do you order something?
Kulani Hlongwane cares for babies at the Malitsatsi Foundation. It's a place of safety for kids. This job hasn't only helped her get back on her feet, she gets to see her son every day. 3 years ago, while living in Limpopo with her 10-year-old daughter, Kulani found out she was pregnant after a brief relationship. Hiding it from her family, she headed to Joburg looking for help.
I was 9 months, not even knowing that I'm 9 months. I was like dizzy because I didn't eat. I called the father of my son. I told him that when I don't have food. And I felt like this dizziness, I feel like maybe I'm going to give birth.
He wasn't interested, and down to her last 400 rand, she had a Caesar at an East Rand hospital. From the hospital, she had nowhere to go. Visiting a church for support, they suggested adoption.
They Ubered for me to this adoption center. There was this social worker. She said, because of you are here and you're saying you need help from us, we're taking the baby. I gave the information, the full information, even my siblings' information, even my village information, everything. I said, I don't want the baby to be adopted, but I need help.
You listen to her story and hear those moments where she's hungry. And in that hunger, she must make a decision that's going to change her whole life. That's not fair.
Tiffany Hine is the foster mother who was called in.
We are, as a family, a place of safety, foster family, and we've gone on to adopt. There were multiple social workers in the room with her when we collected. One of those social workers came out, started with our paperwork, and then another one brought him to us. And the impression that I had in the moment was that this child had been born to a woman who was married as the result of an extramarital affair. If the family found out about this child, her safety and his safety would be in question.
Despite asking the adoption agency and social workers for support, they went ahead and contacted her family, who accused her on social media of trying to sell her child.
So when I checked that Facebook, I was like, now I don't know what to do. The better solution is to kill myself.
The process was traumatic. Kulani had to go back to court regularly so a social worker could say whether her baby should stay with the foster family, go to one of her family members, or be returned to her.
The magistrate, she spoken to me, asking me if I'm giving the baby for adoption. I said, no, I'm not giving the baby for adoption. I just wanted help from them.
Kulani racked up debts trying to stay close enough to visit her son in foster care and show up for court.
What the social workers were feeding to us was that she was an irresponsible mother who didn't care about her child and wasn't even bothering to get to required appearances. Poverty is not a crime. We should be able to, a willing mother that loves her child, and she's shown us that she is a loving mother.
What Kulani needed was practical support. The Maladzadzi Foundation provided that.
For time being, then after, if I get a job, that's when I'm gonna continue taking care of him.
When a position became available at the foundation, Kulani applied. She and Tiffany now co-parent a healthy boy.
She prioritized him even when she was at her lowest, and the system came and just beat her over the head for making a good decision. I adore him. He's not confused by it, but so many adults can't work it out.
It's not what I imagined, but it's not difficult for me that he's having another mother, because he knows that I'm his mother also. He's getting a better life.
The less support parents get from their families and the government, the more likely they are to think about giving up their babies. The D.G. Murray Trust helps children to grow up healthy. The Trust is pushing for a maternity support grant. I'm joined by Liesel Engelbrecht, the Trust's nutrition expert, to explain why. Liesel, thanks very much for your time today. What is a maternity support grant and what would it look like?
It's a form of social protection for women during the most vulnerable period of their lives. So we are advocating for the maternal support grant to be provided to eligible women from the second trimester, and that will be provided to them on a monthly basis, like the child support grant, up until the child's 3rd month of life. And that really is to help the women to have the right nutrition, to have transport, to have access to healthcare services, and really to help her and her unborn child to have a better possible start in life.
Is there any data that you have that shows that something like this would work? Is it, for instance, used elsewhere?
Well, yes. So actually, about 30 countries have some form of social protection for pregnant women. Mexico, Peru, India, Indonesia. And what they've shown is really improved benefits for maternal health, decreased risk of low birth weight, decreased risk of maternal mortality. So quite a strong evidence base that the maternal support grant would be something to help vulnerable women and children. There was a cost-benefit analysis study done last year from one of the researchers at Wits University that showed that a maternal support grant could potentially save 13.8 billion rand in healthcare costs alone. And that's mostly linked to things like low birth weight. The risk really is reduced a lot if the mother is properly supported during pregnancy.
So why don't we have it?
You need some form of coordination, strong political will to make this happen and to push this forward. And it has so much potential. For example, about 20% of stunting can be prevented through maternal nutrition. So, that's a big number because we know low birth weight babies are almost 3 times as likely to be stunted by the age of 2 years.
Why is stunting so bad?
It's a form of chronic malnutrition. So it's persistently not getting the right types of food. So it's not only about not getting enough calories, but it's also about getting those essential micronutrients, iron, vitamin A, B vitamins, all of those things that's really necessary for growth and development. And unfortunately, if the mother doesn't have that, that means that the unborn baby, the fetus, doesn't have that either.
There are so many things we need to pay for. Why would a maternity support grant be considered more important?
This is a relatively small investment to be made that can really have positive long-term consequences, benefits. One low birth weight baby is estimated to cost the healthcare system approximately 250,000 Rand. Just the cost of care of the baby alone. So that's just healthcare costs, and it's not counting in the opportunity cost. For example, if we look at the child support grant, what benefits that has had, there's increased benefits in nutrition and education and health as a result of the child support grant. So yeah, I think, previous evidence from the child support grant shows that it has worked. People are more likely to participate in the economy because of the child support grant. You can buy food, you can buy transport, you can buy electricity.
And yet, Liesl, there are still some people who argue that women get children in order to get grants, however small that grant might be. Why do you think there are still so many misconceptions about that?
Yeah, you're right, Mia. There is a lot of misinformation and misconceptions. But if you look at when the child support grant was implemented, we actually see a decrease in fertility rates. There's no evidence to show that a grant will increase pregnancy.
Liesl Engelbrecht, thanks very much for your time today.
Thanks, Mia.
That's our show for today. Follow us on social media, or if you have a story idea, email us on health@bikisisa.org.